Hello, my name is Michael and this is my shoulder examination today. I've got Cece with me who's kindly helping out. So it's important to note that before we do the shoulder examination, I always like to take full history from the patient, asking about the specific mechanism of injury and any previous injuries, and just to help me build up a picture of what the potential injury could be. But for today I'm just going to focus on how I would approach the examination. So before I actually look at the shoulders, we're always told to examine the joint above and the joint below an injury. So I think it's important to rule out any causes coming from the neck that might give you referred pain down into the shoulder. And how we do that is just by doing a few specific movements with the patient. So Cece, can I ask you to pop your chin against your chest for me? Good. And all the way back if you can. And out to the left side. And then out to the right. Okay, did that bring on any pain or tingling or any funny sensations down the arms? No. So I'm quite happy that there's no gross abnormality with the neck just now. However, if I was concerned, I would do some further examinations. So now we'll move on to examining the shoulder itself. So can I ask you to turn around for me, Cece? So first of all, what we would do is just have a look at the patient. So we're just looking at the alignment of both shoulders, looking for any obvious abnormality. Looking to see if there's any swelling of the shoulders or in at the clavicle or anything that we'd be worried about. If there's any scars from any previous surgeries or if there's any erythema over one of the joints. Now I like to examine the shoulder from the front, the side and the back. And from the front I look specifically at the deltoids to see whether there's any muscle wasting there. If I can ask you to turn to the side, Cece. So again looking at the deltoids there. And if I can ask you to turn all the way back. So sometimes you can see some wasting of the infraspinatus muscles and very occasionally the supraspinatus area. And this could indicate a potential nerve palsy, but it's more often seen on MRI evaluation. Okay, so I'm happy that there's no abnormality there. The last thing, sorry if I can get you to turn back round again. The last thing I like to look at is the scapula. So we're just looking to see whether the scapula are symmetrical, that there's no obvious winging. However, the best way to look for winging is to get a patient to push up against a wall or a door. So if I can ask Cece to go up against the wall and push as hard as you can for me. Brilliant, and that doesn't bring on any winging. Now, if there was winging there, it would suggest that there could be a problem with the long thoracic nerve, but that's not present here. So the next thing I would like to do is palpate in and around the shoulder just to see if there's any tenderness or any abnormality that I can feel. So I always start with the sternoclavicular joint and we palpate across the clavicle, always looking at the patient's face to see that they're not in any discomfort. Now once I've got to the AC joint, I have a good feel here to make sure there's no tenderness or subluxation of the AC joint. And then my examination takes me up towards the trapezius just to see whether or not there's any pain coming from that muscle, which can often present as a shoulder pain. We go down towards the head of the humerus here, and finally I like to palpate just at the insertion of the biceps tendon just to see if there's any tenderness there that might suggest something going on lower down. But that feels absolutely normal. And again, if I get you to turn around, Cece. So again, for an examination I would be examining both sides, but because we're time limited today I'm just going to examine this one side, but I would be doing the same for both and comparing. So we like to palpate the scapula, so over the spine of the scapula and then around the borders there, and again just feeling to see if we can feel any abnormality or obvious winging. Alright, so we're happy with what we've found there. Again, the last thing I'd probably do is just check to make sure there's no heat in the joint, but I would probably have felt that when I was examining anyway. So just grossly checking to make sure that there's no hot joint, which there is not. Now, what we're going to do now is do some movements of the shoulder. Now, I always like to do a few screening tests just before I do the specific movements to get an idea as to whether there might be a problem or not. So the first test that I like to do is to get you to put your hands behind your head if you can. Okay, so this is testing external rotation and abduction. If there was pain there, or it was pain on one side, or they couldn't quite do the movement, then I would be able to be aware that there might be a problem in a specific area. Second screening movement I do is to get them to put the hands on the lower back there. And again, that would be testing internal rotation and adduction. And it just helps me get a picture of what they can and can't do, and if it's pain or stiffness that might be limiting them to certain movements. So the first thing I'm going to get CC to do is do the movements on her own. Okay. Alright, so what I want you to do first of all, again we'd be doing this for both sides, but we're just going to do it on the one side. If you can put your hand against your thigh for me, lift it as high as you can. Good, so CC has got 180 degrees of flexion of the shoulder, which is brilliant. That's fine, you can relax. Now what I want you to do, CC, is bring your arm back the way for me. Good. So again, with extension of the shoulder, CC has about 60 degrees there, which is perfect. Okay. Now the next thing I want you to do is pop your hand on your side there. So we're going to do abduction of the shoulder. So again, straight all the way up. Brilliant. And all the way down. Brilliant. So again, 180 degrees of abduction. The next thing I want you to do is put your elbow in at your side there and bring your arm out if you can. Brilliant. So external rotation, we've got about 70 degrees there, which is normal. Now for internal rotation of the shoulder, there's two tests you can do. We can either get CC to bring her arm in here, which again is got 45 degrees of internal rotation. But what I like to tend to do is, if you turn around for me, CC, what I want you to do is try and reach with your thumb as far up your back as you can. Brilliant. So average is about T5, but CC is well above that. So that's perfect. Now the other thing that I like to watch as well, just to complete the movements, is the movements of the scapula as CC abducts her arm. So if I get you to turn around again, CC, and the movement is hand on the side of the thigh and straight up again. Okay, if you can just do that a few times for me. So I'm just watching to see that there's normal movement of the scapula as the arm is abducted. And that's perfect. Okay, so now we're going to do passive movements where I move CC's arm, okay? And just when I'm doing this, I'm looking to see if there's any pain in the end range of the motion. Alright, so first movement again, hand on the front, and we're just going to bring it up to 180 degrees. Brilliant. Down again, out to the back there. Brilliant. And hand on the side. Brilliant. Very good. And then we bring it across as well. Fantastic. And then elbow in, external rotation, good, and internal rotation. Perfect. Okay. Now the other thing I like to do as well is palpate your scapula as you're moving, just to make sure that they're moving normally. So again, we'll turn you round. Brilliant. Now I'm just going to pop my hand on here, and the movement is you have your hand on the side of your leg again and go all the way up for me. Brilliant. And that scapula is moving nicely with abduction of the arm. Brilliant. Okay, so we have done some active and passive movements. There hasn't been any pain, and there's been nothing to see on inspection. So what I like to do is go on to do some specific tests for injuries that I know are more common in athletes. So these injuries specifically that I look at would be rotator cuff injuries and labral tears or slap lesions. So to test for the rotator cuff, I go through the individual muscles, and the first muscle that we look at is the supraspinatus. So we're looking for any pain or weakness in that muscle. Now the first way to do this is to pop your arm against your leg there and push up against me as hard as you can. Very good. Any pain anywhere? No. So no pain and no weakness, so that's completely normal. The next thing I want you to do, we're going to do a test called the empty can test. So I want you to put your arm out in front as if you've got a can in your hand, turn it over, and I'm going to push down and you push up against me. Brilliant. Any pain when we do that? No, that's fantastic. Now the next thing I would do at that point is assess for painful arc syndrome. So what I want you to do, CC, is hand against the side there, bring your arm up very, very slowly, and then all the way down, very, very even slower on the way down if you can. And if there's any pain between about 60 degrees and 120 degrees, then that is a positive painful arc syndrome. Alright, any pain there at all? No. So the next muscles we're going to test are the infraspinatus and the teres minor muscles. Now, to test this one, what I want Cece to do is put her hands like a boxer. And we're not wanting to assess the pec by moving in the way, we're wanting to assess this movement. So I'm just going to bring you out, rotate you a wee bit there, and if you push up against me as hard as you can. Okay, any pain in the shoulder? No. Very good. The other muscle that we want to test is the subscapularis. So if I can ask Cece to turn around again.
Yep.
This one's called the lift-off test. So I want you to put the back of your hand on your lower back.
Okay.
Yep, just like that. If you bring it out a wee bit towards me and push it against me as hard as you can. Brilliant. That's fantastic. Okay, so I've assessed all the rotator cuff muscles there. Obviously, if there was any pain or weakness, then we'd be doing some further investigating. But at this point, everything's been completely normal. So then I would go on to assess for a slap lesion. Now, the first test that I do for a slap lesion is O'Brien's test. So we did the empty can test earlier on. So if you remember, Cece, we had your arm out like that, we turned it upside down, and if you just put your thumb towards the ground this time, and instead of having it out in this position, I want you to bring it across your body, okay? And then we're going to do the same thing where I push down, you push up against me. And if there's any pain or weakness there, then that is a positive O'Brien's test, but Cece doesn't have that. Okay, so the next test I do for a slap lesion is I'll ask Cece to go into position as if she's about to catch a pitch from a baseball, in a baseball game. So again, we want to just bring you back a wee bit here and push against my hand if you can. Are you getting any pain in your shoulder? No, very good. And the last test that I want to do is called the biceps provocation test. So Cece, if you go into a position like you're doing a biceps pose, bring your hands in as if you're making a swan there, and then do that for me, point it out the way, then point it in again for me, and then point it out. And are you getting any pain at any point worse in or out? No. If the pain is worse when the hands are out like this, then it's a positive biceps provocation test, but again, it's completely normal here. Now the last test that I want to do is the apprehension test. So to do this, again, we get your arm up like this, and I'm just going to bring your arm back like this, and you're always watching the patient's face to see whether there's any discomfort in the apprehension test. If they have an odd sensation, it's almost as if they feel as if their shoulder's about to pop, and that's a positive apprehension test and would need further examining. So we've done all specific tests, quite happy that there's no pain or deficit with any of those muscles. Now, I spoke before about assessing the joint above and the joint below. Now, we did a gross screening test for the neck, and I'm not going to examine the elbow today, but what I do want to make sure is that there's no pains coming from the biceps to the triceps. So we're going to make your arm like that for me, and if you push up against me as hard as you can, very good, and push up and keep your arm like that, and push down against me as hard as you can, very good. So no pains in the biceps to the tricep. So the shoulder examination today was completely normal. Had there been any pains or deficits, I would probably follow up with either some imaging if appropriate, or a reassessment at some point. But again, it would be a combined picture with the history, the previous injuries, and the kind of the history of the pain is really important as well. But that concludes the examination today. Thanks to Cece, and thank you.